Hi, everyone. Welcome to a panel discussion on the topic of 3As for healthcare. The 3As are accessibility, affordability, and availability. The changing demographic profile, prevalence of infectious diseases, and increasing lifestyle-related illnesses pose a challenge to health systems worldwide. These issues led to a higher demand for quality healthcare and present a challenge to keep abreast with advances in technology as well as medical treatment. So technology has emerged as a real driving force in transforming nations, and interventions using technology have transformed several industries. We have seen that happen in banking, in public distribution systems, logistics management, transportation, as well as taxation. So it's time we use technology as a force to drive major improvements in the healthcare sector as well in order to achieve the 3As: accessibility, affordability, and availability. So I'm moderating a session today. My name is Dr. Siddhi Aryal. I'm the Regional Director of Asia Pacific Hub for Vital Strategies, and I have with me an esteemed panel. I will introduce the panel briefly. I have with me Dr. Hissam Shah bin Mohamed Ibrahim, who is the Deputy Director General of Health, Research and Technical Support at the Ministry of Health in Malaysia. I have Izwan Yaqub, who is the Chief Executive Officer and co-founder of MedCard in Malaysia. I have Dr. Sanjeev Pancha, Country President for AstraZeneca Malaysia, and Dr. Sitapon Yongkong, who is with the Department of Pharmacy at Mahidol University, Faculty of Pharmacy. So I want to come next to Izwan Yaqub. So Dr. Hissam Shah highlighted affordability as coming from a lot of different angles, right? So I'll give you one example. See, if a patient is operated on and the surgeon who is operating on the patient performs poorly, he or she will have to endure more operations, spend more time in the ICU, and spend longer time in a normal ward subsequently. All of these will cost a lot of money, which is also one aspect of affordability. The poorer you are, the more difficult it gets for you to, afford all of those costs. So investing in digital technology that allows healthcare professionals to access current, credible, evidence-based information has the potential to lift healthcare and reduce the variable cost, right? As a young startup company that's doing wonderfully well in Malaysia with promises for regional, exploration, I want to come to you and ask you, where can MedCard help in this area? What are your thoughts about innovative solutions that increase affordability for the poorest of the poor? Over to you.
Okay, thank you, Dr. Siddhi. So first and foremost, Alhamdulillah, I think it's a great basically announcement from the Ministry of Health, Dr. Hisham, about the initiative that the government is seriously looking into digitalizing the healthcare. Actually, it's a very good initiative with that implementation. Secondly, when it comes to innovation, right, we will relate this to digital health. And digital health actually, to support, Dr. Sanjeev mentioned earlier, it's about early screening, early diagnosis. So actually, preventive program can help in terms of making more affordability. So with the early screening and early diagnosis, it can help in terms of managing costs. So digital health is basically the way forward, and it has potential to bring better provision care and also to make it affordable to everyone. And actually, based on study 2021, the top health tech trending actually is based on artificial intelligence, AI. Second, on the health data sharing. And the third one, hospital at home concept, like Dr. Hisham mentioned, and also about the wearable monitoring. So these four elements, actually the top studies, health tech trending now, which we should focus on as well. And when it comes to MedCard, right? So we always believe in innovation. To create a better solution, we always find problem and we try to give best value added to our clients or to our user. So actually, parts of our culture to keep innovating so that our user we get more values. And in fact, our tagline is fairer, faster, and healthier together. Fairer means we want to provide a fairer in terms of the price and quality to our patient, to our provider as well. And faster in terms of the claiming process. And in fact, we can make a payment disbursement to the clinic much more faster in time. So and the last one is healthier together. We bundle our service with the telemedicine service, teleconsultation service. We bundle with the opticals. So into one ecosystem that when it bundle together, it can give more saving and more efficiency in terms of the medical spending. And this is where MedCard mission, we want to make a high quality healthcare treatment and make it affordable to everyone. Roger to you, Dr. Sidi.
Izwan Yaqub, turning over to you. I want to hear your perspective about what you think as a young company about these exciting prospects right in front of.
Sorry, you're breaking up. Okay, it's okay. So availability actually is about readiness to be performed to the patient, right? So, and in Malaysia, we do have some health tech startup that already focus on providing a startup digitalized healthcare. And in fact, which cover all these three elements that I mentioned earlier, from the patient-centric, professional-centric, and also organization-centric, which what Dr. Hisham mentioned about the devices, the IoT devices, and the system around. Well, COVID-19 pandemic actually helped the people here open their eyes and accept adoption of the new technology like booking appointment. We have a startup like QMed, BookDoc in place that ready to help our people here, especially during our national vaccination program. They help, QMed helps in terms of the booking appointment. Suddenly where teleconsultation become popular during COVID-19, we have Dr. On-Call, Dr. Us that help us, and the user, the people already get used on how to use teleconsultation service. So this is good in terms of materializing our digital health in Malaysia. We do have a clinical cloud-based system like HealthTix, Sehat, that use the blockchain background. So this is actually good in terms of expanding a better healthcare in terms of digitalizing. And not forget like MedCard, the way we innovate, the way we make sure availability is through the journey of our user, our patient. From the morning they wake up, they know what to use MedCard apps. They know which clinic they can go, what balance they can refer to. And in fact, they can check the balance and without asking the HR or HR in the company. So all this actually already embedded into the apps. And this is a part of our contribution in terms of digitalizing and making a better healthcare service in Malaysia. Thank you.
Thank you. Thank you, Izwan. Question for Izwan I'd like to give from Rafiq Afiq. You know, how does the future of healthcare look like for populations which are not yet tech savvy?
Quite interesting question here. Well, it's back to the question on the infrastructure, physical, and also funding. But this is where digital healthcare can help. To the population. With the pandemic, actually, it helps those patients that not tech savvy try to adopt with the technology. This is where based on the rating, right, to the top 5 2021, the focus which is on the AI, on the medical IoT, telemedicine, big data, and also immersive technology, which include what Dr. Isha mentioned about the genome technology. Our
panel discussion for this afternoon is finally over. I want to thank Datuk Hisam Shad bin Mohamed Ibrahim, Izwan Yaqub, Dr. Sanjeev Panchal, as well as Dr. Sitaporn, and also Magic for this amazing opportunity to get us to converse together. Thank you so much and goodbye.
Thank you, everyone.
Thank you. Thank you very much.
Thank you, everyone.